For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.
Good afternoon, and thank you, as always, for joining us. We apologize for being a few minutes late. Thanks for the patience, but let's get right into it. First slide, please. So, as we always do, just starting with our case numbers, today we're at 23,794 cases reported. It's a 7-day average of 35,669. This is in the face of still pretty high number of tests, increasing number of tests, 368,787 tests, with a test positivity of 11.6%. Next slide. Again, slide that I've shared before, our 14-day positivity at 11.6, thankfully higher than our 7-day positivity that for the first time in quite some time dipped below 10% at 9.9%. So all showing trends in the right direction on test positivity. And you see that in this next data point where we've seen an 8.7% decrease in our 14-day positivity in the last 2 weeks. So good news, demonstrating that we are seeing some reductions in transmission. You'll see that theme throughout the rest of the data presentation here, but I think we're seeing that statewide, not just in certain parts that often have seen that decrease first, but we're seeing it also in some of those most heavily impacted areas like Southern California and San Joaquin Valley. Next slide. Numbers that we've been focusing on quite a bit, the hospital numbers. You'll see for the first time in quite some time, we've had decreased numbers. We saw an 8.5% decrease in the last 14 days to 20,262 total hospital admissions for COVID. And then similarly, a decrease on ICUs over the last 7 days, currently at 4,693. I'll remind you that we often look for projections farther out. We've been looking at mid-January and the second half of January as significant areas of concern because we didn't see as significant a bump over the Christmas and New Year holidays that we expected. We've seen, and you'll see in a moment, that the R effective, that transmission rate coming down, that our revised hospital admission numbers for the second half of the month have come down. They will go slightly up from this 20,262 number over the next week or so, recognizing that we did see some increase in cases, but then hopefully by the end of the month, we're even lower than the number that we see here. So that's great news, given that we were anticipating being well above 25,000 admissions in our hospitals across the state. Just one last point here, you'll see that it's a slightly lower decrease in ICU hospitalizations versus our total hospitalizations. And that's, of course, because patients take a little bit of time to go from a regular inpatient hospital bed to the ICU. And then once in the ICU, many patients stay quite a long time before they're able to be discharged out of the ICU, and that is addressed in this slower decrease than we see on overall hospitalizations. Next slide. So again, we continue to focus on this surge. We have had a pretty significant impact on our state since really the month of December and the first half of January. We have always, in California, led with a public health view to saving lives. We continue to do that in the decisions around this pandemic. It is exactly what led us to put in place the regional stay-at-home order that we believe helped certain sector or certain parts of the state get through what was the hardest part of our surge. And then also more recently, things like our hospital surge order that allowed us to impact where patients went in a deeply impacted county, how the hospitals work together in a certain region to make sure high quality care could be delivered to as many residents who needed it for COVID and other things like heart attacks and strokes and accidents and trauma of all varieties. As I've said, these are rays of hope shining through with the hospitals coming down some and that overall curve of our case numbers beginning to flatten. Next slide. So just to reiterate, those numbers have certainly stabilized, not just in counties and parts of the state that weren't as impacted, but in some of the most deeply impacted parts of our state as well. And these aren't just the case numbers, but those hospital admissions as well, wherein we were seeing over 3,500 hospitalizations a day in the early part of January. As it relates to COVID-19, we are seeing numbers in the mid to high 2,000s, so anywhere between 2,500 and 2,900 on a given day, which is quite a significant reduction, and is exactly what's going to help us support our hospitals, our healthcare providers, to be able to continue to manage this surge. We also continue to work in some continued impacted areas of the state. I've mentioned previously our work in Los Angeles County. That continues to make sure that our systems are working together, that we're able to appropriately discharge patients out of the hospital who can get the needed care in other facilities or at home, working to make sure that our oxygen systems in all of our facilities are up to the task to continue to support COVID and non-COVID patients alike. And then ensuring that we have our 911 systems able to take patients to a place where there is capacity, as opposed to continuing to go to some parts of a county or part of a community where a hospital is more impacted than others. So together, this work continues in Los Angeles, continues to work through San Bernardino and Riverside County, and even in certain parts of the San Joaquin Valley, where they've had some counties harder hit than others, and that's reflected in what the hospital and the healthcare delivery system need in terms of support. Next slide, please. So some more details on this. We committed and have committed to bringing more than 3,200 medical professionals across the state working. Last week, we focused on bringing at least 1,000 new healthcare professionals to serve our hospitals. These are not just ICU nurses and other nurses, but respiratory therapists and other important staff that make hospital care doable and to serve all of the patients that we have. We brought in over 1,500 last week. Goal is to continue to reach that sort of additional 1,000 total, get to 2,000 this week with an additional 500 coming now. We continue to stand up the alternate care sites, ensuring that they are there for critically ill patients, and continuing to build up that capacity that I described last week in 10 specific residential alternate care sites that allow us to serve patients out of some other congregate care facilities, assisted living, the facilities we refer to as care facilities for the elderly, residential care facilities for the elderly, to make sure that instead of having only the hospital as a potential site where they can receive care, these new stood up facilities to allow them to receive support that they need, maybe oxygen commensurate with what you might get in a home setting, so that we can avoid having to send these individuals to the hospital and still provide them with the care that they need. Next slide. So earlier I talked about how the transmission rate has come down. We've talked since the beginning, you first heard about R naught, then this R effective concept. Again, really just, it's our rate of transmission. This slide shows how many different inputs the state takes into account. We've talked about this as our ensemble model, really a collection of different entities that track California's R effective putting them together. And the most important detail to take from this slide is that we are below 1. That means that it sort of supports what we're seeing in the case rates, that we are starting to see the decline. Of course, we want to see this as low as possible, as far below 1 as we can possibly get. But the good news is that we're in a posture where the spread of COVID is not growing in the state, but decreasing just a little more slowly than we would like. Next slide, please. I wanted to take a moment also to highlight what we've been seeing in our skilled nursing facilities. I think many of you have followed with us the impact on skilled nursing facilities, both because of the congregate nature of the facilities, the fact that many of the residents are among our most fragile older Californians in the state, and then the fact that it also serves as a place to serve older Californians. So altogether, very vulnerable environment, very vulnerable residents in our skilled nursing facilities. And to show that before this current surge, middle of November, we were seeing about 153 cases a day. We saw a peak in the middle of December at 730 cases in a day. And now we've come down significantly, still above our pre-surge low, but much lower than the 730 peak, which is good news. We continue to track this on a daily basis, making sure that our skilled nursing facilities have all that they need to track the progression of COVID, making sure that testing is available, ensuring where we can to provide the staff needed. And I think this is all reflected in this this number that is coming down quite a bit since that peak on the 19th of December. Next slide. So again, we want to always urge folks to keep up what we've been doing. We know that it has been a difficult journey to this point. We've talked about how we want California to continue working until we're through this pandemic, through the vaccine portion, where we can begin to reopen most of our society and our economy in many ways. And I know we're so hopeful to that. But at this moment, we still need to continue to do the things that help us get our effective rate down, our cases down even farther, so that we can begin to see some of the activities and actions that I know we're all looking forward to. So never miss a chance to emphasize the need to continue to be at home as much as you can, only going out for work or other essential needs, to wearing your mask when you're outside of your home, and then limiting and not gathering with those outside of your household to keep the spread down. There's still a tremendous amount of COVID in our communities. Yes, a little less than before, but still a tremendous amount. Still case rates on a day over day basis that are higher than most of our nation. And we need to continue to work to bring that down to get through this, so that we can recognize the benefit of vaccines and other things and help us get to the other side. Next slide. So wanted to catch you up on where we are on the Vaccinate All 58 campaign, our campaign to work with all 58 counties to ensure that we are vaccinating as many Californians as we are able to. You've been following along, many of you, at the focus over a 10-day stretch that ended on Friday to get 1 million extra doses or additional doses into the arms of Californians, and a number of things. I just want to say tremendous thanks to all the partners that came together, our county partners who really worked hard to make sure that we had accurate data, that we were doing as much as we can to stand up our ability to put vaccines in arms of Californians, to get as quickly as possible our healthcare workers and other priority populations served as soon as possible. Today, we're reporting 1,525,815 doses administered. So this exceeds our 1 million dose goal. We still have data coming in. It's very much like testing was, where even if a test was administered on a certain day, it took a few days for the data systems to catch up and count it as a test. So we're still assessing how many we were at on Friday, the 10th day of our million vaccine challenge. But we do know as of today and over the weekend that we surpassed that goal. It would have been at 1,488,000 doses roughly. So we're beyond that now, which is great news. I will highlight that we had a peak day on Friday of over 110,000 vaccinations done across the state. We think that number will continue to go up little by little because of that reporting lag that I mentioned. And compared to the day right before we started our 10-day challenge, we were at 47,213 doses. So then more than doubled in this period of time, really a testimony to the hard work of our counties, our healthcare delivery system, the number of others who are standing up events to get Californians vaccinated across the state. We know, as I said, that there's a delay in reporting. This is one of the valuable things we learned over the past 10 to 12 days, working hard with our partners to make sure that data is entered in a timely way and ensuring that the data systems capture it. We're making some improvements as we go along. Really appreciate everybody's work together to make sure that we get the numbers accurate. I will tell you, because of these data delays, that we're confident that even more than the 1.5 million individuals that we've captured the data about, we believe that that number is underestimate of the true number of Californians who've been vaccinated, which is really the ultimate goal and the best news. We know that we've received a total of just over 3.2 million vaccines. I should say that's the number that's been shipped to the state. We work hard to figure out what's actually been received, with each of those health departments across the state and our large healthcare systems who do receive a direct allocation from the distributors, either Pfizer or McKesson, for the Moderna vaccine. We'll continue, because this is our highest priority, the governor's highest priority, to be in an all hands on deck sort of formation, working quickly to get vaccine into our communities, but also to ensure that we do that as safely as possible. Next slide. Wanted to spend a minute talking about two issues. First, this issue of the new variant that was discussed over the weekend that was identified and looked at here in California. And then next, about a certain set of doses for the vaccine from Moderna that California is looking at closely. But first, on the variant, this new variant, we talked to you a couple of weeks ago about a variant called the UK variant, the B117 variant to be specific. That is a type of COVID virus that looks different than the COVID virus that we have traditionally been seeing here in California and across the nation. It had some mutations in its genetic code. It was picked up because of the tremendous work that California and other people look at across the globe to assess what the genetic code is of each COVID virus that we see. And we've discovered this new L452R variant. We're still learning a lot about what it means, working hard with the tremendous genomic sequencers at institutions like UCSF and Scripps and other places across the state, working with the CDC and our local public health partners to continue determining what the role of this variant has been in our transmission rates across the state. This was first identified last year in not just California, but in other parts of the state. We know that it was recently identified in several large outbreaks in Santa Clara County. Some of those outbreaks in some of the congregate care facilities that we know are prone to having broad and large outbreaks. So working to determine if this variant similar to the UK variant has any increase in infectiousness, what its impact might be on vaccinations and in other areas of concern. So more to come on that, still determining not just how broad this variant is across our state, but also the exact specifics on what the variant will mean in terms of infectiousness and impact on things like virulence, how severe the disease is, and if there's any implications on the efficacy, effectiveness of vaccines. Again, these variants just underscore the need to continue to keep our guard up, that if we do see variations in how impactful, how infectious this strain of the virus is versus the one that we've been dealing with for many, many months now, it will certainly impact how we can move forward. So we're hopeful that we continue to keep our guard up, that we do all of the things like wear your mask, stay home when you can, many of the things that we've shared before, so that we can keep transmission, no matter which variant you're prone to see in your own community, try to keep that down as much as possible. Next slide. So as I've mentioned, many of you have followed that last week, or really the week before, there was a set of individuals who had what we think is really an allergic reaction to some of the vaccines from a specific lot that is a specific shipment of Moderna vaccine. We've been looking at it very, very closely. We know that it was fewer than 10 individuals who received vaccines from this lot that required medical attention, and this occurred at a community vaccination clinic. We immediately began working from the state with those local public health officials, the site where the administration had occurred, as well as the CDC and the FDA, to determine what to do. Over the weekend, we determined that the direction should be that the rest of the vaccine from that lot that had come to California, that we should pause on using it until we are certain that it's safe. We believe that we will come to some resolution soon. Our scientific safety review committee is in fact meeting today to discuss it, to synthesize the information that we've received in conversations with the CDC and FDA and make a determination. We know that this has meant that some counties, some sites who've been distributed this, allocated this lot of Moderna vaccine, postponed some vaccination clinics. And we know that that is can be disappointing or distressful to some, but as we've always said, leading with safety is important, and we want to be able to sort of move forward with this vaccination supply if we can, as soon as we can, and we will keep you all posted. As I said, about 330,000 doses are distributed to about 287 providers across the state, and this shipment arrived between January 5th and January 12th. So certain individuals have already received some of this vaccine that same day, where we had those individuals with the reaction occur, received the vaccine without any trouble, without any reaction. We've obviously been in follow-up with many of those individuals to ensure that everything has gone smoothly as expected. And so we're not worried about what has happened already, but moving forward, want to be certain that it's safe to use. And as soon as we have that certainty, we'll release a statement and ensure that those partners begin vaccinating, because that is our top goal at this moment with our vaccine campaign. Next slide, please. So by way of wrapping up, you'll notice that we've said we can slow the spread and now end the pandemic, with so much of our work to get through what looks like the hardest part of this surge, not over yet, but certainly through some very difficult times as a state, in certain parts of the state. Grateful to our public health partners who continue to lead and support the counties, those hospitals and clinicians nurses, doctors, therapists, phlebotomists, all the people who help care happen in a hospital setting, in a clinic setting. Just very grateful to your tremendous and heroic efforts over the last many weeks and many months since the beginning. And now with vaccine and the real attention to ensuring that we continue picking up the pace, that the only limiting factor in California to vaccinating Californians is the supply that we receive from the federal government and from our distributors to, in the end this pandemic and help us get through it together. So with that, I'll turn it over for questions.
Angela Hart, Kaiser Health News.
Thank you, Secretary Ghaly. I have two questions for you. One is in the bucket of boring vaccination information question, but let me start with my question about Sacramento. Why did California allow the Sacramento region to open when the ICU numbers on the ground were around 6%? I understand the state's looking at projections, but when the ICU numbers on the ground show a different reality, why is the state sort of breaking its own rules? If you could explain that. And then in the boring vaccination information category, is there any update on when specifically the state will provide information by county on vaccinations given broken down by race or age, et cetera? And then the other one on that category is, a lot of counties say they can't see all of the information that they need to run an effective vaccination campaign. They can't see the vaccines that are going to healthcare providers, for example. So is the state, what is the state doing to communicate information to those counties so they can, make this happen on the ground?
Yeah, so first, thank you, Angela, for the question. So first, I would say we're not breaking our own rules. On the first, we've always said that we'd look at projections 4 weeks out from any date that we're looking. And that is takes into account where we are today with ICU numbers, but also what are the case rates, what is that our effective number, where are the trends going? Because we know that ICU numbers are a lagging indicator. You've heard that term before, that it's one of the last things to happen, and that ICU numbers today reflect case numbers from 3 to 4 weeks ago. So looking 4 weeks out with today's conditions helps us understand what the capacity would be in the future. So even though Sacramento, the greater Sacramento region was in a roughly 6% at the time that we lifted the regional stay-at-home order, our 4-week projections were above 15%, which is our threshold, and that's what gave us the comfort. Thank you for asking the question, because it gives me another chance to explain how we look at it, because this may come up again with other regions of the state. The reality at the moment that it's the regional stay-at-home order is lifted is they may be below 15%, but the reality is the projection shows that they'll be above it soon. With regards to the mundane or boring vaccine questions that you asked, I think they're part of exactly where we need and plan to go to as a state, making sure that counties have an understanding of what's coming into their county, not just the county health departments, but all entities that are providing vaccines. We know that this is a partnership between local public health, state, many vaccinators. I'll remind you, when we do flu vaccine, although this isn't the flu vaccine, there's a lot of differences here, but when we do flu vaccine, local public health, for example, does a small percentage of the total vaccines for a community, largely done through partners in primary care and clinics, hospital and other delivery systems, pharmacies, for example. So the need to get accurate and complete information to the counties as well as statewide is important. One of the key efforts over the last 10 days or the 10 days during our challenge was really working hard with what we call those MCEs, those multi-county entities, those healthcare delivery systems with facilities in many parts of the state, working with them to make sure that we capture that data effectively and accurately, similar to what we did with the counties and the many individuals providers working with county health departments on distributing vaccine. So bringing that all together in a way that isn't just shared with the county partners, but with all Californians is where we're heading. I can't tell you exactly when the team will have it up and ready for viewing by everyone, but I can tell you that it's in the works, and it's something we're working hard to do to be clear with all Californians where we are, not just in the state, but in the counties that each of us live in.
Ron Lin, the Los Angeles Times.
Hi, Dr. Ghaly. Thanks again for taking our questions. We really appreciate it today. Our questions today are on vaccines, reopening, and the variants. First, CDPH's data shows the state was more than 250,000 short of the 1 million dose goal that you said has now been reached. You mentioned there was a lag in reporting this information, but that seems like a significant delay. Is there always this large of a delay in reporting this information to the state? And does the state have a new goal for how many daily doses they would like to see administered across the state? Second, there's hope California is emerging from the worst of this wave of this pandemic, as you mentioned. There will be pressure to reopen as quickly as possible, but we also know that reopening too early can cause problems. How will you balance those competing demands? Finally, as you mentioned, there's deep concern about these multiple variants like L254R and the UK, South African, and Brazilian variants. Will those variants reverse the progress we're seeing? And is it possible current vaccinations will be less effective against them? Thanks so much.
Yeah. So first, to the first part of, or the first of your questions, we learned a lot about how significant the delay is in data. So what I mean is when a vaccine is given and when we can actually count it in our systems and the data has shown up, we've seen delays. Sometimes it's 48 hours. We've seen it up to 96 hours in certain cases. So still working through determining exactly what that delay looks like. So your point that we were 250 odd thousand difference on Friday was we knew that number is actually much smaller than that because of the delay. We're still working through determining exactly what the full number was on Friday, but I think it's safest to say that at this point, so even if it's 24 hours longer than we expected or 48 hours longer than we've expected, the good news is we've added more than 1 million doses since we put out the challenge to ourselves, that we've done that we have over 110,000 doses administered on Friday, which really the last business day when we knew vaccinations were sort of going the fastest and most across the state. And that's tremendous progress. So we think that we'll continue to see that and work on it. And we aren't trying to say we reached a goal that we didn't reach, or we're not trying to say anything more than we're really proud with the progress that we have at this point reached the goal and continue to work to amp up our operations. In terms of the surge question and the issue about reopening, we have the blueprint that we've used before. We continue to use it today. Normally, I'd update you on tiers, but the truth is there's no movement on counties that we're eligible to move. Most are in purple. I think we have 4 counties in the red and orange tier across the state, but there are no new movements there. And the good news is, as we come out of this worst surge that we've seen, that we have the regional stay-at-home orders lifted and counties go back to the blueprint tiers, that they will go right to where they belong as soon as that regional stay-at-home order is lifted, and we will continue to use that structure for the foreseeable future. Absolutely, the concern with variants of all varieties is that it changes the behavior of the virus. We see mutations in viruses all the time. RNA viruses are notorious and known to have mutations even more than other viruses. So the point is, are they important variants, right? Do they affect the level of infectiousness? Do they affect virulence or the level, the severity of disease? we continue to learn as much as we can, as quickly as we can, updating all of you along the way to whether those are material changes and have the impact that we might worry about. So far, I don't have any additional news on the variant that I described here and that was here in California and Santa Clara County. We've shared our understanding of the B117 variant, that UK variant, that it creates more infectiousness, so more likely to be transmitted, but not necessarily creating more severe disease. The impact on vaccines is one that we always have to ask that question about, but we don't yet have any determination that there is reduced efficacy of the vaccines because of these variants, and we'll continue to look at it with our partners in academic institutions and other labs across the state, the nation, and the globe.
Kathleen Ronayne, The Associated Press.
Hi, Dr. Ghaly. I also have two separate questions on different topics. So first has to do with vaccines. You said that the state has shipped about 3.2 million doses out, and about 1.5 million have been administered. So that's about 1.7 million doses that haven't been administered. We're hearing from San Francisco County Public Health, for example, that they're going to run out of doses by Thursday. So do you have a sense of where those 1.7 million doses are and why they haven't been given out yet? Are they being reserved to be second doses? And if not, why are we in a situation where some counties are running out? And then secondly, you talked about the four-week models that allow us to know that Sacramento's ICU capacity is going to go down. Are those models, publicly available for the other regions of the state? Is there something that people can look at to see the model 4 weeks out for their region so that they can get a real good sense of what the data is showing us and what projections you're looking at in real time?
Sure, I'll try to address both of those questions quickly. So on the first, so the number that the 3.2 million number roughly is what we believe has been shipped. We continue to work to make sure that it has all been received. It is shipped on different days. As we've indicated before, there's a whole process where we're told an allocation from the federal government to the state. We then share what the different counties are going to be receiving, and then they put in orders, and then those orders are sent to the CDC and then ultimately shipped later in the week. So it's this pretty elaborate process over the course of many days between when we're told an allocation is made and when it's actually shipped and then received by an entity. Just to remind folks of that 3.2 number is all doses, so first doses and second doses. Some of the remaining doses are indeed second doses available to individuals when they need it, whether it's 3 weeks after the Pfizer or 4 weeks after Moderna, to make sure we have supply there. Then there's a good number of the remaining doses that are in some ways planned with people who are coming to, whether it's small pods or mega pods, these big vaccine events that some counties are putting in place. They have the supply of vaccine now for events and activities that will happen over the next many days. And then there is just the entire planning process of, we just received the vaccine yesterday. Yes, it's waiting to be distributed, and now scheduling patients to receive it. So the complexities of this vaccine rollout are real. The cold chain storage, that refrigeration freezer storage, is a real important operational detail that is being worked through. So yes, there's a significant number of doses that are second doses. Some are sort of on reserve for events now. And then what we are hearing from all of our partners, whether it's a county partner or a healthcare delivery system partner, is whatever they have in terms of vaccine is being planned to use now, and some are pretty close to being out of additional vaccine now. And that's why we continue to work with our federal partners, looking forward also to working with the incoming administration to make sure we have as much vaccine as we can get into the state of California to allow us to continue moving quickly around the goal that as soon as vaccine comes into the state, we are able to vaccinate Californians and be able to do that as quickly and swiftly as possible. Again, pointing to the incredible increase in the level of vaccinations day over day that we saw over that 10-day period, climbing from just about 47,000 vaccines on the day before we started that 10-day challenge period to over 110,000 on the last day. As it relates to the projections on the stay-at-home order, yes, we regularly look at each of the eligible regions to determine where they are that day with their projected numbers. We often report it as either you are still below the 15% to lift the order, or you've been above it. So we continue to do that on a very regular basis, and have some of those details on how that calculation is done on the CDPH website.
Joe Cohen, the New York Times.
Hi, Dr. Ghaly. Thanks so much for taking our questions. I'm kind of building off of some of these vaccine distribution questions. I'm wondering if you can talk a little bit about how vaccine doses are being allocated and distributed within the state. Really more allocated, I guess. For example, how many are going directly to counties versus healthcare providers versus pharmacies, and has that changed at all given the expanded eligibility to anyone 65 and older? And then, how is the state deciding how many doses should go to each county? Is it a direct function of population, or is there any adjustment for severity of outbreak? And again, has that shifted? And then finally, what would you say to people trying to sign up for a vaccine that have, not a lot of idea where to look right now, or confused about what they're hearing from their county, or maybe not hearing from their county versus the state? That's my question. Thanks.
Yeah, no, thanks. All great questions. So remember when we were in 1A, looking at healthcare providers and individuals in congregate care facilities, the allocations were looking at the proportion in the state of those individuals in each county. So if you're a county that happens to have a regional hospital that draws from other counties, a bunch of the main health facilities there, an over-representation of skilled nursing facilities and other congregate care facilities, you might have seen a higher proportion of doses going to that county based on that allocation priority, given where we are in the phases and tiers. As that shifts to be beyond that 1A group into the 65 and older, you will see those allocations shifting bit by bit. We know that overall, the percentage going to the counties and the percentage going to the multi-county entities, the big healthcare delivery systems that are getting direct allocations, has been stable over time up until now, but that will shift as the focus on who should be vaccinated changes. We know that one of the important functions and tools we have to make sure that we continue to lift up our focus on equity in our vaccine distribution is ensuring that certain more deeply impacted communities and areas, not just counties, but even parts of counties that have been more deeply impacted than other parts, do receive, because of the providers who get it, because of the county's own allocation plans, to ensure that those areas do get a amount of vaccine in proportion to that impact. So there's a number of different tools that we have used, will begin using based on where we are with our prioritization plans across the state. The number one factor, though, that we're hoping to see increase is the total amount of vaccine, because we believe that getting as many Californians vaccinated as quickly as possible is one of our key strategies. I'll also say that you'll have tracked that we have opted in throughout most of the state to the federal pharmacy partnership that helps us vaccinate in our skilled nursing facilities and other congregate care facilities like assisted living facilities across the state, working with CVS and Walgreens. And their allocation, although it comes out of our total state numbers, those numbers go directly to those providers to continue to vaccinate Californians. Oh, before we go to the next question, what would I say to individuals who want to know what they should do to figure out where they are with vaccines? Stay tuned, working on a number of different tools and options to make sure that we can communicate crisply, concisely where different individuals fall with vaccines. I know it's something that is a very important question to many, and I know certain people have already heard from their healthcare providers what might be coming. Other people haven't. We hope to really move to a greater deal of consistency and clarity around this, because we know it's an important question for so many Californians, especially now as we move beyond the focus on just healthcare workers, on just congregate care facilities, to 65 and older individuals across the state, and others who are wondering when they'd be vaccinated. I think this is certainly the time when that is becoming more and more important, more and more relevant. So working hard to make sure we can communicate clearly with all of our healthcare partners, all of our county partners, to all Californians who are wondering the same thing.
We have time for 2 more brief questions. The next question comes from Andrew Sheeler, the Sacramento Bee.
Hi, Dr. Ghaly. Thank you for answering our questions today. I have a question about youth sports. It's currently guidance says that it's set to resume inter-team competitions on next Monday. Is the state really on track for youth sports to resume?
So thanks for the question. No, it's a very important one. We're working with a number of different partners and youth sports leaders, including CIF on certainly high school interscholastic sports, to determine how the current conditions across the state impact that start date. So working hard. Don't want to get too far ahead of those conversations, so we'll update you soon on that. But obviously the state of the surge and the conditions in many of our communities are pretty dire, pretty significant. So trying to work with those different partners to make sure that we land in a place that allows us to do what we've always wanted to do, which was resume activities that so many people miss, but do it safely.
Final question, Victoria Colliver, Politico.
Hi, Dr. Ghaly. I'm going to squeeze 2 brief ones in. So you explained a bit about the vaccination allocation process, but is there a greater role the state can play in helping the regions of the state hardest hit by the pandemic, like the hot spots, both obtain and vaccinate more of their residents? And on the Moderna lot issue, can you explain, like, if this is potentially site specific? You know, like what could cause just those adverse reactions at that site rather than widespread?
Yeah, sure. So on the first one, as we anticipate additional vaccine coming into the state, we are constantly assessing with our local partners and a number of others the distribution and allocation plans. Many people have said that looking at certain regions most hardly impacted is one way to do it, looking at different other ways to segment the state and the population. Think again, for all of these issues and efforts, the number one thing we want to make sure we do across the state is make sure that we're doing this safely, with speed, and in an equitable way. And so ensuring that whatever allocation plan we come up with focuses on those primary drivers, that we bring as many partners into the work as we can, not just local public health, who's been tremendous, but many of our other healthcare partners, our pharmacy partners, others who can help deliver vaccine, so that as we see an increased amount of supply into the state, that we can quickly and swiftly get it into the arms of Californians in an equitable and safe way. So I think with that, I'm going to wrap up today. Thank you so much for all of the questions. Thank you for the opportunity to share what is that glimmer of hope, that bright light still in the tunnel, but hopefully through the darkest part. And with all of the focus, as you heard from the questions on vaccines, really amping up and increasing our capability across the state to deliver that part of the promise, and looking forward to working with a number of you to make that happen and a reality for all Californians across the state. So with that, have a great rest of your afternoon.
For the latest information regarding the COVID-19 pandemic in Cupertino, please visit cupertino.org/coronavirus.